You do start to view the world a little bit differently after you've been through a situation like this. I just thought about my child. Like, dying is not an option for me. I have a 2-year-old child.
They made my life normal again.
It's been 2 years that she had the surgery, and she hasn't had one seizure since. I would say probably that they've given her her freedom.
We tell everybody we can, that Bob had a stroke, and look at him, he's 100%, he may be 105%, and we owe it all to the you.
The Clinical Neuroscience Center is much more than a building. It is a group of people working together, a group of professionals working together to provide health care for those people who have neurological diseases.
The university offers very unique resources. They're really unique not only in the United States but worldwide. We have a Utah population database. It uses the pedigree, the family tree information. We have used this recently to start to look at neurodegenerative diseases, and we have made some very unusual and amazing discoveries.
The young people that we train are our force multipliers. They carry the torch, they make the commitment, and then push the field on.
Lisa came to me when she was in her early 30s, and it was about 2-3 years that she has been diagnosed with epilepsy. She was having seizures, and she has tried 1 or 2 medications, and they did not work, and she was suffering from their side effects.
This didn't start until 2005, so we'd been married for, what, 12 years at that point? I didn't know how to react to it. And so the first grand mal that I watched her go through was just complete panic for me.
In some cases I felt depressed, very alone. After talking with Dr. Afra, I could tell immediately she knew that she was doing a much better treatment there. I mean, it was fantastic.
Unfortunately, in this day and age, the only cure for epilepsy is surgery.
I'm tired of this. I'm tired of, I can see a difference in the way I'm acting. Let's see what happens. I think the biggest reason that I was pretty calm about it was also the doctors that I worked with.
I was able to perform a surgery where we could actually remove that portion of the brain without causing her injury otherwise. And in that way, we were able to cure her seizures.
Now that I've had the surgery and things are a lot better, we've been able to visit family. And then even doing the little things, not being afraid to cut a carrot.
Our Clinical Neurosciences Center is very unique because it brings together not only excellent physicians but also scientists in the field of neuroscience. Over the 3 decades that I have been a neurologist, neurology has vastly changed. When I entered neurology, there were only few treatments for epilepsy, there were no treatments for multiple sclerosis, neurocritical care did not exist. We have really seen a revolution in neuroscience care, and this revolution is continuing. I think life is just a long soccer game, and the way we deliver neuroscience care here in the Neuroscience Center is as a team.
We have an amazing program called the Telestroke program. There are a lot of hospitals in the state that don't have the expert stroke care in their hospital that we have here. And so we have been serving 12 different hospitals within the state since about 2004.
A couple of years ago, I had a stroke. I couldn't get out of bed. I couldn't reach telephone. I couldn't do anything.
We were both stunned. I couldn't move him. He couldn't move.
I met Bob, this sounds funny, but I met him at 2:30 in the morning because he came into the emergency department in Moab. The physicians there were concerned that he was having a stroke, and they called me up and paged me. I got to view his head CT, and he got an IV right there in Moab, an IV treatment called TPA.
As soon as that drug was administered, I could start to feel the effects of the stroke dissipating.
Seeing him piled into the ambulance to take to the airport, I was very scared. And I didn't know what state I'd find him in when I got to Salt Lake. He was in the room, sitting up, surfing for the World Cup Championship games. He was 100%. Learning about the Telestroke program and watching it in action, it didn't seem possible. What we took back from the experience is to give back. That has been enriching for us.
We do taxes for low-income people during the tax season. And I'm a member of the volunteer fire department here in Castle Valley. I've just been trained in a new CERT, Community Emergency Response Team program, and things that we can do to help the community. None of that would I be able to do if I were suffering the effects of that stroke.
The room that we're currently standing in 3 short months, will be a unique piece of equipment and a unique place to practice medicine. This room is designed to allow us to be able to take a magnet on rails, I think you can see that behind me, and move that from room to room. So in essence, we'll be able to have magnetic resonance imaging real time as we're doing various procedures. So private funding has actually made this facility possible. With the generous donation, we're able to bring this technology into the University of Utah.
I'm Spencer Checkett saying goodnight. Have a wonderful Tuesday evening, and we'll do it again on a Wednesday on The Big Show on 1280 The Zone, the sports leader.
You're listening to The Big Show.
I have a real passion for it. I have a real passion for sports talk radio, and I feel blessed to have the job, for sure.
Spencer came to us emergently. He had difficulty with coordination and walking. A scan was performed which demonstrated a large tumor in a dangerous location, and it required a surgery to remove.
When you can't do things and you're telling your body to do it, when you can't hold your own child, when I'm telling my left hand that's on the wheel of the car to turn the car left and it just sits there, it's a terrifying thing. And that's when I realized this is bad. We talked about a couple of different destinations, and Dr. Caldwell's name kept coming up as the guy you need to be taking care of you. And at that point, we made the decision that Dr. Caldwell was driving the ship.
I treat every patient as if he or she were a member of my family. And all of the clinical decisions that I make, I put them in that context because it brings it close to home. You realize the impact of the decisions you're making in their lives.
One of the most powerful moments in my entire life was Bill Caldwell walking into my hospital room and looking at me and saying, look, we've got a long surgery ahead of us, but I'm going to tell you, I'm going to go get it. I'm going to go in there and I'm going to go get it. And I went, okay, a chance, chance is all I need.
Spencer's outcome exemplifies what modern neurosurgical care can achieve. And so it's remarkable how the technological advances in our specialty has helped deliver great care to patients like Spencer.
Dr. Caldwell was certainly my hero. I'm alive today because of the Neuroscience Center. There's no doubt about it.